These older adults are just a few of the Americans leading healthier lives thanks to research by the Prevention Research Centers, or PRCs, a program of the Centers for Disease Control and Prevention. The PRC program is a research network hosted by schools of medicine or public health. Each PRC finds new ways to reduce chronic diseases such as cancer, diabetes, arthritis, and heart disease. Chronic conditions are the leading causes of death and disability, responsible for 7 out of 10 deaths in the United States. But the picture doesn't have to look bleak. Chronic disease is the most preventable of all health problems. The PRCs tackle the situation by conducting research to transform community environments and influence policies that improve health. The PRCs collaborate with underserved populations whose health risks are greater than the national average.
So here's the opportunity.
Each PRC has a community committee or board that pinpoints health issues and helps create and test solutions. This input makes it likely that community members will participate in the research and adopt successful policies and programs because the solutions fit the community. The PRC's range of community connections and expertise is broad. Some centers focus on strategies for healthy aging, like enhanced fitness, which improves the physical fitness of older adults and people with arthritis. It is proven to increase strength, boost activity levels, and elevate mood.
There's a lot of fitness trends out there, and they're not all necessarily based on sound research. They're not all necessarily based on what's best for a special population.
With support from the CDC Arthritis Program, 11 states are now in the forefront of taking enhanced fitness nationwide. Most PRCs work with minority groups whose health risks are greater. Research covers high blood pressure in African Americans, diabetes in Latinos, hearing loss in American Indians, tobacco use by Asian Americans, and other risks. Several PRCs partner with residents of rural areas or urban areas to find ways to promote physical activity, immunizations, or healthy eating. In New Orleans, where Hurricane Katrina devastated already scarce supermarkets in many neighborhoods, one PRC helped form the city's Food Policy Advisory Committee. Thanks to the committee, a fresh food retailers initiative is bringing fruits and vegetables as well as jobs where they are needed. Some PRCs research how technology can impact health. For example, one PRC studied internet sales of cigarettes to minors. The U.S. Senate cited the research when it passed a bill to cut internet sales of low-cost smokeless tobacco and cigarettes. Other PRCs focus on issues in populations that may be overlooked: obesity in the deaf community, heart disease in people with mental illness, or routine health screenings for public housing residents. Some centers concentrate on youth. Topics include obesity, depression, or sexual health.
A no should be no.
These students are learning to prevent teen pregnancy by using It's Your Game, one of the many proven health promotion strategies developed by the PRCs. The program involves schools and parents and creates an environment that supports middle schoolers as they make decisions about sex.
Sometimes they follow in the footsteps of their family members by, sister gets pregnant, mom was pregnant at a young age, and I want them to know that they don't have to follow those footsteps and break the cycle of teenage pregnancy.
Now It's Your Game is available to school districts across the country. It's Your Game, enhanced fitness, and other results of PRC research would not exist or would go nowhere without partners. The PRCs work closely with state and local health systems, national health organizations, and federal programs. These partners help communities use the PRC's cost-effective, practical health promotion strategies. As these collaborations grow, so does the impact of the Prevention Research Centers. The PRCs and their partners, creating healthier communities together.